Now at the Aminu Kano Teaching Hospital, one of northern Nigeria's largest health facilities, a recent power outage has sparked outrage. Reports indicate that some patients have lost their lives after electricity supply was cut, despite repeated plea from the hospital management to the distribution company. The incident has raised serious questions about accountability and the protection of critical health institutions. In the aftermath of the incident, the federal government has announced plans to take the hospital completely off the national grid. Abdulazeez Ibrahim reports.
Aminu Kano Teaching Hospital currently spends about 150 million naira monthly on electricity bills and an additional 30 million naira on diesel to run its generators. The Chief Medical Director of AKTH confirmed that although appeals were ongoing to settle accrued bills, the disconnection of power by the Kano Electricity Distribution Company KEDCO may have contributed to tragic loss of lives.
Unfortunately, on Friday, around 5 p.m. in the afternoon, KEDCO decided to come and cut off the light in the hospital. Luckily for us, we have solar power in most of the vital areas where we need services as an emergency, for the hospital. And we're able to sustain for a while, until early morning hours of Monday. I'm aware we have lost some lives in ICU, and this is not an uncommon event. However, we'll find out specifically if this power failure has actually resulted in the death of anybody in the hospital, not just the ICU.
KEDCO, however, insists it acted within reason, stressing that the hospital owes nearly 1 billion naira in accumulated bills. The company explained that it had repeatedly advised the hospital to separate its staff quarters from the main hospital complex in order to manage its debts more effectively.
That suggestion also to Aminu Kano Teaching Hospital, separate. I'm sure your bill will come down, then we'll talk about how payment plans are now, because we know they can't pay 1 billion one time. So definitely it has to be a payment plan, right? And we're willing to sit down and do that. So, we wrote notification notifying them on that. We went twice to separate, they refused us access.
On Wednesday, the federal government announced a 12 billion naira solar power project for the hospital. The project will deliver a 7-megawatt hybrid solar station designed to take AKTH completely off the national grid.
Together, we will deliver a project that will completely take AKTH off the national grid, ensuring an uninterrupted power supply for its over 700 beds, thousands of staff, and critical life-saving equipment.
While the solar project offers hope, the outage has exposed the fragility of Nigeria's healthcare system and the urgent need to safeguard hospitals from the devastating impact of power disputes. Abdulazeez Ibrahim, Trust TV News, Kano.